Hello everyone, welcome to the second part of INICET Inflammation High Yield Points session. So in part 1, we have discussed a lot of high yield points for your upcoming INICET or your next exam. We have discussed very high yield topics and lot of facts which are not normally mentioned in any textbooks. So in part 2, we are going to continue with the rest of the topics, and of course this is a very short session, so let me start without wasting time. First one, cellular mediators. The most important cellular mediators of acute inflammation, you have to remember, this is what we call it as histamine. It is derived from histidine amino acid. Mast cells are the richest source. Remember, it causes vasodilation. But the question it causes vasoconstriction in large arteries. We have another important mediator. I am just going to say the high yield topics. Okay, I am not going to explain any concepts here. Nitric oxide, it is also called as endothelial derived relaxing factor, EDRF. Endothelial derived relaxing factor, also called as EDRF. Now let us see what are the pyrogenic cytokines. This has been asked in PGI 2016. Please remember the whole list. You should remember all these pyrogenic cytokine: interleukin 1 alpha, 1 beta, TNF alpha, TNF beta. Please remember it is TNF beta. It is not TGF beta. It's not TGF beta. It is TNF beta. Then interleukin 6 and interferon alpha, not interferon gamma. Remember the question what they are going to ask. Interleukin 18, it is also a member of interleukin 1 family of cytokines, but remember it is the only interleukin which belongs to interleukin 1 family which is not a pyrogenic. Remember, interleukin 18 is not pyrogenic. Then let us discuss about the various family of chemokines. Number 1 is what we call the C chemokines. They are also called as gamma chemokines. Okay, here there will be as the name indicates C chemokines. Am I right? Yes. So C, CC, CXC and finally CX3C. Okay, here there is only one cysteine residue, example lymphotactin. Beta chemokine, here we have 2 cysteine residue, and here example all WBC except neutrophils produce this type of chemokine. Example is MCP1, rantis and eotaxin. All these are potential MCQ question. You should remember this: MCP1, rantis and eotaxin. Then we have CXC chemokine. Here 2 residues of cysteine are separated by 1 amino acid. They are also called as alpha chemokine. Examples are interleukin 1, 8 and TNF, tumor necrosis factor. Then we have CX3C. Here 2 cysteine residues are separated by 3 amino acid. Examples are fractalkynes. So please remember, we have alpha, beta and gamma chemokine. Sometimes they may ask which of the following is an example of beta chemokine. Beta means CC chemokine. Okay, how I used to remember? I just remember any one of them naming. Fine, any one of the naming. So rest you can remember. So beta means in Greek letter alpha, beta. Beta comes 2. So 2 means 2C. So CC chemokine, best they are called as beta chemokines. Okay, in that only we have examples MCP1, rantis and eotaxin. Okay, yes. Gamma, it is C chemokine, lymphotactin. Alpha, it is CXC chemokine. Okay, examples are interleukin 1, 8 and TNF. Then the 3 important functions of bradykinin. Are pain, vasodilation and increased vascular permeability. Okay, they are straight MCQ questions. Once that is done, we have different inclusions in granulomas. Out of these, the most important thing is 2 are there. One is called asteroid bodies and another one is called the Schaumann bodies. What are asteroid bodies? As you can see here, they are stellate shaped inclusions. Okay, they are stellate shaped or star shaped inclusions. Okay, within the granuloma. And remember, this asteroid body and Schaumann bodies both are present in sarcoidosis. Okay, both are present in sarcoidosis. I am drawing a double-edged arrow like this. Both are present in sarcoidosis. Fine? Yes, because you know sarcoidosis is an example of what type of granuloma? It is an example of non-caseating granuloma. Yes, sarcoidosis, I am going to write it again here. It is an example of non-caseating granuloma. It is an example of non-caseating granuloma. Okay, we have what we call as stellate inclusions and Schaumann bodies. Schaumann bodies, as you can see, some blackish deposit. They are calcium oxalate deposit. Okay, I am zooming the picture. You can see, you know, blackish deposit here. They are nothing else but the calcium oxalate crystals. Okay, yes. Then what are the different types of matrix metalloproteinases and its function? Number one is what we call interstitial collagenases. They will cleave the fibrillar collagen. Then number two is what we call it as gelatinases. Gelatinases are mainly matrix metalloproteinases type 2 and 9. Okay, remember type 2 and 9, they are gelatinases. They degrade collagen and fibronectin. And finally, the third one is what we call it as stromolysins. See, stromolysins, it may be a potential MCQ question. They are MMP 3, 10 and 11. 3, 10 and 11, they degrade the extracellular matrix components. Okay, stromolysins. Okay, I'm just highlighting it. Stromolysins. STRO. Okay, stroma, like that. Stromolysins. Fine. Yes. Then the stages of wound healing, we have inflammatory stage, repair stage and mature stage. So the neutrophils appears within 24 hours. Okay, neutrophils the maximum peak within 24 hours. So the inflammatory phase is between 0 to 5 days, repair between 5 to 21 days and maturation is between 21 days to some months. Here some important question. The granulation is maximum on which day? Day 5. Neovascularization is maximum on which day? Again, it is day 5. Fine. Myofibroblasts start appearing which causes wound contraction. That is again between you can go for the answer like up to maximum of 3 weeks. Okay, in the option it will be there 3 weeks. That is 21 days. Then and finally from 21 days to month we have what we call it as the cross-linking and the tissue structures are reformed. And here comes the question, what type of collagen is present in granulation tissue? Granulation tissue have type 3 collagen. Okay, at the end of wound healing, the type 3 collagen will be replaced by type 1 collagen. Type 3 collagen which is present in the granulation tissue is replaced by type 1 collagen. Then we have some important question, wound strength. Okay, at 1 week it will be 10%, at 3 months it will be 70 to 80%, and the most important question here, the wound strength will never attain 100%. Okay, yes. What are some of the conditions in which there will be delayed wound healing? Diabetes, you know, it is an immunocompromised state, steroids, infection. And here comes the question which has been asked in AIMS. Okay, zinc deficiency. In zinc deficiency also there will be delayed wound healing. Okay, in zinc deficiency also there will be delayed wound healing. Then of course I have discussed already about hypertrophic scar and keloid. Here there comes an important condition. Okay, this picture has been asked once in JIPMA. Okay, JIPMA they have asked this question. And what is this image? Okay, this image is nothing else but proud flesh. Proud flesh is because of excessive granulation tissue. Whenever there is excessive fibroblast, you know, all those we say contracture, hypertrophic scar, keloid, and similarly whenever there is excessive granulation tissue we call it as proud flesh. And at last but not the least, Robin's 10th edition updates. What are the positive and negative C-reactive proteins? They are also called as acute phase reactants, or they are also called as C-reactive proteins. C-reactive proteins. Okay, the best example of acute phase reaction, first example, positive. Positive means these their level will be increased during inflammation. Negative means their amount will be decreased during inflammation. Let us see the negative one, that is albumin, transferrin, transthyretin and retinol binding globulin. Very, very important. You should remember this list. Other than this, of course, serum amyloid A, haptoglobin. Haptoglobin has been asked as an MCQ. Fibrinogen has been asked as an MCQ. Then ceruloplasmin, alpha-2 macroglobulin, alpha-1 acid glycoprotein and C3, C4 complements. All these are examples of positive acute phase reactant. Remember, albumin, transferrin, transthyretin and retinol binding protein, or RBG, they give retinol binding globulin. Okay, all these are examples of what we call negative acute phase proteins. So with this, we have covered almost all the very high yield concepts and the maximum MCQ questions they can be asked in any of the entrance exam. Okay, hope you would have enjoyed this session. Thank you.